Hi everyone, I'm Sabdi and I'm here with Marissa and Lucia, and we're gonna talk about schizoaffective disorder today. So, this is the conceptual roadmap that we have planned for today. The introduction, what exactly is schizoaffective disorder? How does this relate to class content and future directions? Where can we go with this research? So, I'm doing the introduction today, and so for starters, I want you students to type in the chat if you have ever heard of this disorder, and if so, what do you know about it? I'll give you 10 seconds. Okay. So, schizoaffective disorder is an illness that is combined with aspects of schizophrenia and a mood disorder. Schizophrenia being the way that you think, it affects the way that you think, act, and perceive reality and expect emotions. Mood disorders change your feelings, energy levels, and behaviors. There are two types of schizoaffective disorder: depressive types, where patients experience lows of depression, and bipolar type, where patients experience several days of highs, being mania, and several days of lows, depression. Why is it important to study? Schizoaffective disorder is challenging to diagnose and it's a rare disorder. I think less than 3% of the population have schizoaffective disorder, and many people see positive outcomes if diagnosed early. So it's very important to work on prognosis and helping people seek diagnosis early, so it's easier to treat. And it has no cure, and it's a chronic illness, which means advancements in research could help people live better lives.
Now that we have an overview of what schizoaffective disorder is and why it's so important, we can connect this back to class content. But before we do that, students, go ahead and use the chat box and put some of your ideas on why schizoaffective disorder is related to class content. Go ahead and submit your answers in the chat box. Okay, so as we learned, schizoaffective disorder is this combination of schizophrenia and affective disorder. That's depression, mania, and paranoia. This relates to our discussion on anhedonia, which is the inability to feel pleasure, a major component in depression and schizophrenia. It's believed that circuits involved in the reward and aversion are dysfunctional, which result in those symptoms. Regions such as the mesolimbic system, the frontostriatal, and the mesocortical regions of the brain are involved. Closely connected to anhedonia and depression is neuroticism, which we've covered pretty extensively throughout this course. This is the propensity to feel negative emotions and is found to be pretty stable over the lifespan. It's positively correlated with depression, which may be useful in early indication for major depressive disorder. So, what exactly does all of this mean? Well, there are these bidirectional links between anhedonia, neuroticism, and depression, which are both all components that schizoaffective disorder are centered around. So, we may be able to utilize these links to aid those suffering from symptoms. As we mentioned before with neuroticism, these links may help us with early detection for vulnerable individuals. So testing early for neuroticism may reveal those with a higher risk of developing depression. That with schizophrenia symptoms may help professionals make an earlier diagnosis. Earlier diagnosis means that people are treated much earlier, and it's found that schizoaffective disorder actually has better treatment outcomes than those with schizophrenia, but it can be quite hard to diagnose. So that prolongs treatment. So getting earlier access to the diagnosis may increase patient outcomes.
So now that we have a better understanding of what schizoaffective disorder is and how that relates to class content, I want to talk more about where the research in the field is right now and the future directions and directives that we can take. So where is the research right now? There was a review done by Pavlichenko et al. In 2024 where they, with certain limitations and guidelines, compiled and looked at a list of all of the research that's been done on schizoaffective disorder so far. And the conclusion that they came to, based across all these papers, is that schizoaffective disorder, or SAD, is still not well defined. And the one thing that they do agree on is that it's one of the most unstable, debatable, and least reliable diagnoses in psychiatry due to the fact that there is so much overlap between schizophrenia and depression. A lot of different researchers have different opinions on when it should qualify as SAD. Something else that they found was that imaging data shows overlap with schizophrenia and bipolar disorder, especially in the prefrontal abnormality. So that kind of goes back to showing how much overlap there is in patients that were diagnosed with SAD versus patients with schizophrenia or bipolar disorder. And so right now, a lot of what psychiatrists and researchers are working on doing is solidifying the dimensional models and to create a better guideline for and more clear guideline on how to diagnose someone with SAD. And for some future points of research, one of the main things is understanding the relationship between affective and psychotic symptoms, because that will give a lot of clarity and what sets apart schizoaffective disorder from something like depression or schizophrenia. And something else that we thought was interesting was when we were looking into how this relates to class content, there weren't a lot of studies done on neuroticism and how that affects it. So definitely looking into that relationship so that we can better understand how to treat patients with schizoaffective disorder and target the root of the problem rather than just the symptoms like we've discussed with something like anxiety. And we do acknowledge that there are a lot of limitations, especially with the sample sizes of these studies. There's not a lot of patients that are diagnosed with SAD, so we're not able to have a large sample size. And again, the disagreements from and how SAD is defined is also making that difficult right now. So that's all we have for our flash talk. Thank you guys for listening, and we hope that you were able to take something away from this presentation.